From the far-out free-lovin' 60s to the groovy disco of the 70s, even the big hair 80s, The Brew plays only classic hits. KOKL, Okmulgee, Oklahoma.
SJ, welcome to Mvskoke Radio, your weekly source for tribal and community news, interesting guests and discussions, plus a local events calendar. SJ, Stongo, Gary Fife, Joho Jifkidos, Mvskoke Radio, Mabo Hedger, Welcome to our program this week, and this week is another example of Seat of the Pants live radio. We have got our Secretary of Health, Shawn Terry, and a guest to talk about a couple of items there. And in the second portion of our program, we'll be speaking with Natalie Russell, who is the Young Child Wellness Coordinator for the tribe here. And she's going to be talking about Project Launch, which is a look at different techniques of parenting and talk about how it comes along. Now, I understand that there's Dr. Beets along with Secretary Terry, so let's just get on with it, and let's just talk with these gentlemen. Good morning, gentlemen. Are you with me there?
Good morning. We are with you.
Okay, again, I'm ever so grateful for that. It looks like we were doing a little juggling here in our scheduling, but this will work. This will work out. So first of all, thank you, gentlemen, for making time for us. Of course, Shawn Terry is the Secretary of Health for the Mvskoke Creek Nation, and I understand there's a Dr. Beets along with you, sir.
He is with me, and we know that there's been a lot of questions and concerns and about the flu epidemic that's rolling through the area. So I asked Dr. Beets to sit in here with me. So,
and his first name, by the way.
Yeah, Dr. Billie Beet.
Okay, great. Mm-hmm. And let's start off with you, Secretary Terry. Now, I understand you've had a press conference this week to update the community on the status of the hospital and clinics being opened up by the Mvskoke Creek Nation. Is that correct, sir?
Yeah, we were interviewed by a few newspapers. Yeah.
Okay, and what is the main thrust of that? What did you want to share with those news outlets?
Well, there was multiple. We wanted to update, first of all, the community on the status of Okemah. We have moved into the outpatient side of the new Okemah facility, and everybody's wanting to know and about when the hospital side is going to move. And we were just getting the word out that we're in the final couple of weeks here. We're waiting on some state inspections, and that's kind of a dance that happens between construction and the architect and us and the state. So it's really hard to nail down just a specific time, but we expect over the next couple of weeks we're going to finalize those inspections and get completely 100% moved over. So
are you with me, sir?
I am.
Okay.
Yeah. Yeah. So anyway, that was the gist of that, and then also there was some questions still about where were we at with the Eufaula project, and we're about 65% complete going in here to the first of the year, so we're still ahead of schedule and expecting to open up probably the end of the summer.
Okay. Let me ask you about Eufaula. Now, I want to make sure I get my information here correct. There was a problem with a contractor there at Eufaula. Was that correct?
Not to my knowledge.
Okay.
We haven't had, so I'm not aware of any.
Okay. Perhaps that was at Okemah. Was it?
I think there was some problems early on at Okemah.
Okay.
But I think that those got resolved quite some time ago, even before I came a year ago. So I think that that's been resolved.
Okay, can you tell us the nature of that situation?
I really can't. That all kind of happened before my time, and so I really didn't dig into the nature of it. Our construction management program at the tribe, they were really the owner's rep that dealt with those construction companies, so it really wasn't something that the Department of Health was engaged in.
Okay, well, I think the key word there is resolved, is it?
Yes.
Okay, well, that's good news, and we're happy to share that. Now, there have been some, perhaps, I don't want to use the word confusion, but it wasn't clear to many people that who would be eligible to use certain portions of these facilities. Now, I understand you're making a push saying the community hospital in Okemah will be open to the entire community, correct?
Absolutely, and that is a message that we really want to get out to the citizens of Okemah and to Okmulgee, the medical center here. Both of these hospitals are community hospitals, and they are open to the public. So we want, this is an investment that the tribe has made, not just with its citizens and Indian beneficiaries, but it's really been an investment in for the entire community. And so we want patients from Okmulgee using the services here. We want them coming to our emergency room, using our X-ray equipment, our CT, our MRI, the lab, and as well as Okemah. That's what that facility was meant to be, a community facility.
When you run through the list of ailments there, that is a normal kind of workload, so to speak, for any hospital?
You know, we're a hospital system that really is about 80% outpatient. So we do about 2,000 visits a month through our emergency rooms. There's roughly a split between the Okemah ER and the Okmulgee ER. So we do a lot of emergency room visits. And then we also do a lot of diagnostic imaging with CTs and MRIs and mammograms and ultrasounds. And then about 15 to 20% of our business at any given time is the inpatient stay. So our doctors do admit patients with pneumonia and things of that nature.
All right. Now, would that include something like a cancer case or some hip replacement or something like that?
You know, if we don't do any total joints in our system, we do have an employed orthopedic physician that's in our system that he does some outpatient orthopedic procedures. As far as cancer goes, you know, we may have a patient that shows up to the emergency room, and we may admit them while we're doing some testing. If a patient we suspect is going to have cancer, we're going to transfer that patient to a higher level of care. We don't have any oncology services at either one of our hospitals. So once it's determined that they need that oncology consult, we're going to ship them out.
So more complicated problems then would be referred to another facility?
Yes.
Okay, well, while we're in that particular area, that would seem to call into a need for something like contract care now. I understand that there was a boost in the budget for that sort of thing, contract care being a number of things, I imagine. But tell me about that. What's that situation?
Yeah, so, you know, anything that we can't provide in our system, we pay for patients to go to outside the system through contract health. With our finances this year, we were able to put about an additional $5 million in 2018 budget than what we had in 2017 budget. So that's drastically expanding our ability to approve contract health referrals. So we really are going to take care of a lot more patients this year.
That's got to be good news for folks out there who are seeking help. Now, as an example, under that particular service, would something like surgery on your eyes, I can't think of the phrase I'm looking for.
Ophthalmology.
Yeah, like when you might have some problem there with the eyes clouding over. And
we actually do ophthalmology surgery at Okemah and a little bit here in Okmulgee. So if you come into our eye program and one of our optometrists from our facilities is going to do that referral, that would start with our own ophthalmology program in the tribe.
Yeah, a cataract, that was the word I was fumbling for there. And other things like, internal organ transfers, replacement, would that fall under those kind of categories?
Those kinds of things are stuff that's usually that we are going to send out to a higher level of care. We're going to handle most things. If somebody comes in with appendicitis, or someone's going to come in with pneumonia or the flu and they're needing a bag of fluids, so we're going to be taking care of elementary hospital level conditions.
Mm-hmm.
We don't have the specialties out here to do that. We have, however, been broadening. We now have Oklahoma Heart Institute that is coming down to Okmulgee 6 days a month and providing some cardiology clinics here in town. So we're doing 2 days a month of non-interventional cardiology, non-invasive cardiology. We're doing 2 days a month of peripheral artery clinic, and then we have 2 days a month of cardiovascular surgery clinic. So that's a really nice service for our people to be able to have that level of cardiology care here locally and not have to drive into Tulsa. Mm-hmm. And then also this, I think it was last Thursday, we started our first urology clinic here in Okmulgee. And there's really a national shortage of urologists out there, and we were lucky that Dr. Day Kim, he's with Utica Park Clinic in Tulsa, he wanted to come out and provide some of that care locally, and so we're real excited that we're going to have him here as well.
Okay, now, I know we started off the program with it, but I want to return briefly to the eligibility for services. Someone from the community needing help will be served as needed, I presume. But for other facilities, you will have to be a Native American with the old CDIB, Certificate Degree of Indian Blood Card.
That's right. If you go to any of our outpatient clinics, you're going to it's going to be required that you have a CDIB card. If you go to any of our hospitals, though, the rehabilitation hospital, Okmulgee Medical Center, the here and Okemah, you can show up and not have to have that CDIB card.
The question pops into my mind then, if you are not a Native American and you require service and are being served by these facilities, how's it get paid for?
Well, we bill third-party insurance, so these are for-profit hospitals here. So we're going to bill your Medicare, your Medicaid, your private insurance, and if you are a non-native, you're going to get a bill in the mail. Mm-hmm. However, but it is a lot cheaper for us to be providing care in this community than it would be if you were to go to a larger system in Tulsa. So if you're going to have a CT or an MRI or you're coming here, not only are we closer, but it's also much less expensive to get your care here.
A question comes up in my mind, and people are being taken care of. We've probably all heard the phrase, well, Indians get health care for free, but that's not exactly the case. Most Native people who come in for service and do have some sort of insurance have been billed for some time now.
Well, so here's how it works. So the Indian Health Service, they provide us a per capita funding a year. So we get about half of our money for our annual operating budget from Indian Health Service. However, several years ago, they gave us the ability, because they knew that we were underfunded, so they opened it up and said, we expect you and your patients that have Medicare to have Medicaid, because those are federal funding sources as well, and we want you to bill those patients their Medicare and Medicaid and private insurance. So about half of our budget and funding comes from Indian Health, and then we have to make up that shortfall. So we're obligated by the government to bill those services through Medicare and Medicaid. That's why we really want to make a push and really encourage our citizens when they're eligible for Medicare or they're eligible for Medicaid or private insurance, that we need to take advantage of that.
Now, in the last couple of years, we've heard a push to eliminate what was referred to as Obamacare and this sort of thing. And I'm wondering how those kinds of discussions and maneuverings up in Congress affect what you do and the price to be paid by patients here on the ground level. I mean, do you have to look at that situation and what might be your concerns?
Well, what was passed through the latest tax plan was that there was a repeal of the individual mandate for people to carry insurance on the Affordable Care Act. However, on the Obamacare exchange is still in operation, and there are specific plans that are designated to natives on there. In many of those plans, when you're eligible, it's all based on your income, and so you can get plans for as some people pay $17 a month to have Blue Cross and Blue Shield insurance, or $100 a month. So it's very reasonable. So we're a little bit concerned that those individual mandates were repealed, because that's not encouraging people to go out and sign up. But so far, we're having to just kind of watch what the impact's going to be. And there may be an instance in the near future, we're looking at the numbers, where we may do a tribal assistance of helping our citizens pay those premiums so that they can have a private insurance plan as well.
Right. I know a lot of people had questions and were confused about all of the language and discussions being tossed back and forth, and some people got kind of hot under the collar about that kind of thing. Well, let me shift our discussion. We don't want to ignore Dr. Beets here. Also in the national headlines, we're hearing lots more about flu this season. One of the things we heard was that the vaccinations that have been in place were not quite as effective on this strain of flu, that there are quite a number of fatalities being reported from people who have succumbed to this disease. So first of all, sir, could you tell me about the situation that you see within the Creek Nation, the state of Oklahoma, or nationally?
Yes, sir. What you stated is correct in that the flu this year is, very bad. They're expecting a very bad flu season. And within Creek Nation itself, we have had, as of last Wednesday, approximately 200 cases throughout our clinics and our hospitals that tested flu positive. and 77 of those were in the medical center across the street in Okmulgee, and about 45 at Creek Nation Hospital in Okemah. However, last Thursday we noted that we had a significant increase in the number of positive flu cases. So I don't have the new numbers, but I would estimate that we're at least half again, or maybe double what we were prior to last Wednesday. We've had a number of staff at our facilities that have been out with the flu. I actually just spoke with the health administrator at Sapulpa, and we had 10 staff members out today with the flu there. This flu this year is particularly virulent. If everyone recalls the swine flu a few years back, everyone was, very concerned about that. This flu this year is also a type A flu. There's a type A flu, type B flu, and then you have different strains within those types. This flu this year is also a type A flu, but it's much more virulent than the swine flu. And so we're expecting a pretty significant flu season. Now, if you look at the state, my knowledge, we've had 22 deaths so far from the flu in the state of Oklahoma. Flu tends to mainly impact those who are older, 65 or above, or those who are about 2 or younger, and also those adolescents and those young adults who think they can get the flu. They can get the flu as well, and you're especially concerned with those individuals who have diabetes or asthma or COPD because they're already dealing with other issues, and so it just impacts them a little bit harder. As far as Creek Nation, both the emergency rooms, they're fully staffed as usual. They're not turning anyone away. The wait times may be a little bit longer because they have been overwhelmed. They've had to increase some staffing at both facilities. We have our infection prevention department who is constantly monitoring the CDC and the Oklahoma State Department of Health to look and see if there's any new alerts. I know that on the West Coast, they've had some state of emergencies and they put tents in their parking lots and stuff. That's primarily been because the emergency rooms are overwhelmed. In the state of Oklahoma, especially in the Tulsa metro area, a lot of the major hospitals there have been on what we call red divert, which means they have no beds on the floor, they have no beds in the emergency room, and they only take cases like heart attacks, strokes, those types of things.
So it might be good then if you have a provider to start with them and check in with them.
Absolutely, and we always encourage that. There's been some studies that have shown in health in general that the best way to protect yourself, and that extends to your family and your community and our tribal society, is to get your annual yearly checkup. Not to just come to the physician or to one of our clinics when you're ill. We want to do preventative measures. Make sure your vision's okay, make sure your blood sugar's okay, your cholesterol, things like that. Unfortunately, a lot of people, they'll wait until they're really sick before they come to one of our facilities, and then by then, they've kind of went down the road in some areas we could have prevented or possibly help lessen the impact to their health and to their family.
Yeah, that's a thing I've heard all my life is, I'm not that sick, I'll just wait a little while and it'll go away. And it doesn't. And so they end up having to seek medical care like that. Have you seen and dealt with a lot of that kind of denial sort of thing?
Yes, we have, and I don't think that necessarily is just specific for our tribal nation. Mm-hmm. I think that's kind of an attitude in general. A lot of times people don't want to find out if something's going on until they have to because they're unsure how they would be able to deal with the diagnoses or have to tell their family what's going on. But, if we can get prevention in place, then they may never have to have those conversations with their family, with their friends and loved ones. We have had a push within the Department of Health, and we're continuing to do so, in trying to get people to come to the clinics for checkups, especially young men. If you look at the data, women tend to come to the clinics, on a routine basis. They'll bring their children. Older folks will come in, but the young men, about the only time they'll come into the clinic is if their wife makes them go. And, we see a lot of that. And I think it's important for leadership, within our tribe, in our families, because if you can have, one of the elders in your family or something go to a physician and show that this needs to be done, that would have a significant impact on the younger folks.
Right, those younger folks, and I didn't mean to laugh to make light of it, but it just reminds me of sitting in a waiting room and hearing that kind of thing. I came because you made me kind of stuff, and I didn't want to do this. I wanted to go play golf or go fishing.
Well, I think that's part of the male gender because, even me as a physician, it's like my wife is like, you need to go to the doctor. I'm like, what do I need to go to the doctor for? And she's like, so I think that kind of is ingrained in us that we're supposed to be, impenetrable and nothing can affect us. But, unfortunately, we have a lot of, younger men in our tribe, and we have a high level of diabetes and et cetera. And then, they don't get taken care of. They get sick, and then that impacts their children. That impacts, their wife or their partner. It impacts, their church they go to or their ceremonial ground they go to, and so we're all in this together. So we need to take care of each other and make sure people get done what needs to be done.
Dr. Beets, let me ask you this: what's the difference? I think is essentially what I'm asking is between this year and last year. They're saying that the vaccine is not quite as effective. Does that mean that the would you call that a virus or something is stronger or is evolved to deal with these countermeasures? What's going on there?
I wouldn't say that the virus has evolved to fight against us or things like that, but every year, basically, we have the federal government through the CDC, and they have their own subcommittees. They basically meet and kind of look at what's going on in the southern hemisphere because, they have a different seasonal direction than we do. And so they kind of look at what happened in these countries and how can we prepare. And so they basically do all these studies, and then, in essence, they make their best guess on what they think is going to hit us in the next year. And then they start, developing the vaccines for this. There have been some years when our flu vaccination has covered the type of flu that hits us completely, and there have been some years, unfortunately, like this year, where it has not. Right now, they're saying basically that our current flu vaccination has about a 10% effectiveness level. Does that mean that you don't need to get a flu vaccination if you haven't had the flu? No. You still need to get the flu vaccination. Now, just because you get the flu vaccination doesn't mean that you're not going to get the flu. It just means that if you do get the flu, that you have decreased length of time of having the signs and symptoms, and severity is not as bad. Also, for those individuals out there who may have already been diagnosed with the flu, they may want to speak to their provider to determine if they had flu A and B, or just flu A or just flu B. Because if you have not been vaccinated and you say, I've already had the flu, you may not have had both strains, so you may need to go ahead and get a vaccination anyway.
The subject of vaccines has been a bit of a controversy over the past few years with some parents saying that vaccines will create an autistic situation in their child or someone in their family. Would a flu vaccine fall into that same category? Was any discussions, by the anti-vaxxers, including flu vaccines?
Well, I have not heard any discussions from those who are anti-vaccine in regards to the flu vaccine. Typically, you hear that on the vaccinations that we give our little ones, when they're born up to 12 years of age or so. And, and there has been, I think one of the impetus behind that group is that over time the number of vaccinations have increased that we're giving our children. But, there's not been any credible scientific studies or evidence that would validate that vaccinations cause autism or cause any of these other, neurologic conditions. Is there a risk of some type of adverse reaction to a vaccination? Absolutely. There is with any medication that you take. But, one of the issues that we find is, we had thought for years we had essentially eradicated polio, we had essentially eradicated measles and all these other illnesses. And now, partially because of the anti-vaccination movement, we're finding that they're not vaccinating their children. And so they're basically not just putting their children at risk, they're putting the general community at risk as well.
Right. A unvaccinated child could spread that throughout his classroom. Now, what is there? Are there people who should not be getting a vaccine? I mean, for whatever medical reasons, shouldn't be receiving these medications?
In general, no. For the most part, everyone is eligible to get a flu vaccination. Of course, we don't vaccinate babies less than the age of 6 months. And they need to be extremely cautious. It's very important that the people that are going to be around them, their loved ones, are vaccinated to help protect that child from the flu. Of course, they need all patients need to speak to their primary care physician, about their particular circumstances. But to my knowledge, there's really no contraindication for the most part to get a flu vaccination unless you may be allergic to the components of the vaccine. Okay.
Now, what might be some symptoms that people would want to look for in watching out for the flu?
The symptoms that we typically see with the flu is going to be a severe headache. It can be a cough. It can be nasal congestion or a runny nose, aches, chills, sore throat, and, sometimes some people can have nausea, they can have vomiting, maybe even diarrhea, because there's two different types of flu we're dealing with. Unfortunately, the thing is, and this is another reason why people should get vaccinated, is people can be contagious with the flu a day before the symptoms even begin. And once the symptoms begin, typically they last about 5 days. We recommend, and the latest recommendation is that you basically stay out of work or school for those 5 days, and then you wait at least 48 hours after that before you return to work.
Okay. And as you were running through that list of symptoms, I was thinking, in some of my younger days, I know I did have it where you had all those symptoms at the same time and had pure misery for about 5 days.
Yes.
Okay, well, Dr. Beets, is there any final word that you'd like to leave with our listeners here before we return to Secretary Terry?
Well, I would encourage everyone, it's not too late to get your flu vaccination. And even when you start having signs and symptoms, you can still get a flu vaccination up to 2 days after your symptoms begin. I would encourage people, to make sure they set up those preventive appointments with, their clinicians, our physicians, so we can make sure that, we keep them healthy. And, our ERs are always open if they need to come see us.
Okay, great. Finally, Secretary Terry, I know that's been kind of up in the air, but do we yet have a date for the opening of the Okemah facility down there?
Well, we are open on the outpatient side,
right.
So we are seeing it. But as I had mentioned earlier, we're still waiting on some state approvals. We did a walkthrough yesterday, on Monday, and with the construction and architect and our facilities guys, and so we expect within the next couple of weeks we'll hopefully by that last week of the month we're going to shoot to have the inspection done. And so once we get that last inspection done and the state gives us approval, then we'll get a date and a grand opening set.
Great. Well, you can count on Mvskoke Media being there to cover the event.
Well, we'll absolutely make sure that the time and look forward to it.
Great. Wonderful. Thank you, gentlemen. Dr. Billie Beet and, of course, our Secretary of Health, Secretary Shawn Terry. We want to thank you, gentlemen, for making time to talk with me this morning on some very important health information. We're going to keep our eyes on both of the situations, and don't be surprised if we give you all another phone call in the future.
Anytime. Thanks so much.
Okay, thank you, sir. All right, we'll take a pause here for a couple of messages real quick, and then we'll be back with Natalie Russell, and we'll talk about their project launch on child discipline. So please stay with us here on Mvskoke Radio on 1240 The Brew.
I started doing it when I was 11. I wanted to be just like my big brother. And some of my friends were already doing it. We got hooked fast. I just can't get enough. I'm Jacob, and I'm addicted to playing the drums.
There's lots of stuff that makes it cool to be Native. Doing meth isn't one of them. Find something better to do. Check out ncai.org. A message from the Partnership for a Drug-Free America and the National Congress of American Indians.
Who am I? Am I Native? I don't want people assuming things because I'm Indian. I just want to be me. But how do I live in two worlds? Some guys just check out by doing meth. But that ain't for me. Because I see my family, my friends, my drum making, my future. There are a lot of cool things about being who I am. And meth isn't one of them.
Learn more at ncai.org. A message from the Partnership for a Drug-Free America and the National Congress of American Indians.
Welcome back to Mvskoke Radio here on 1240 The Brew. Sitting in the studio with me now is Natalie Russell, who is the Young Child Wellness Coordinator there. Couldn't read my scribbles there for a second. Thank you, Natalie, for coming in. We appreciate you making time here. We have an intriguing subject. You have a couple of public seminar series coming up focusing on the subject of discipline and children there, and takes a unusual approach, shall we call it, to dealing with the subject. But first of all, what does your particular office do?
I am with Mvskoke Creek Nation Project Launch. We are with behavioral health. We focus on children and family, or children and families with children 0 to 8. We do parenting classes majority of the time. And we also have 5 other strategies that we focus on, which is home visiting enhancement, family strengthening, and that's where our parenting classes falls under, early childhood mental health consultation, integration of behavioral health into primary care, and screening and assessments.
It's quite a handful.
It is.
Particularly with what can be a rowdy audience there, with little ones there. The Project Launch is one of the programs that you put out there in an outreach effort, I presume, and that's an intriguing title. So what is, first of all, Project Launch?
Project Launch is linking unmet needs in children, and we just focusing on strengthening those families, focusing on capturing them while they're young, and keeping them out of the jail systems, equipping our parents with the strategies that they need to be able to do that. We
have heard that phrase, offering parenting skills to young couples, so many times. That's kind of an outgrowth of changes in our society where we're having children essentially, and when not equipped to train them, to discipline them, to educate them as old folks like me were. So this is kind of a way to fill in the gap and offer services and support to those folks who may not be familiar with this, right?
Yes, and sometimes when it comes to parenting is not for the faint of heart, that is for sure. I
can hear all the heads nodding.
Yes, if we are good parents, we are constantly frustrating our kids. We're asking them to do things that they don't want to do, like go to school, go to bed, and then asking them to quit doing things that they enjoy doing. They're in the middle of their video game. It's time for bed. I don't want to quit. So if we're doing our job effectively, we are frustrating our kids on a daily basis. And in response to that, what we get is most of the time testing and manipulation. Or if we have a well-conditioned child or disciplined, they can tolerate that frustration and comply.
Mm-hmm. So it's kind of one way of getting them used to finding out that you can't always get what you want.
Very correct.
Okay.
And it's really hard as a parent because we're faced with that testing and manipulation, and it's not always easy to handle. We get emotional, we get frustrated, And so part of what 1-2-3 Magic does is gives us the 6 basic testing tactics that kiddos use, and then it gives us practical ways to handle it so that we're in control and the kids are not.
Okay, now disciplining, I can't even get it out. Disciplining children is probably the basis for about half of the situation comedies on TV. Like, how do we handle kids? And they've got some comic method of doing it. But it ain't quite that way in real life, right?
I think it can be humorous at times if you can, remove the emotion from it.
Mm-hmm.
But no, it's for the most part, it's very real. You get your feelings hurt, you feel guilt, all those normal parenting emotions.
Right, and probably have heard and have tried them a few times myself in my younger days, which we'll not get too close into.
I think we all have.
Yeah, now, we have seen an evolution, a change in our society in the way we look at the use of discipline with kids. There are probably thousands of listeners out there saying, yep, when mom and dad got mad at me for doing something wrong, it's like go get the switch or get out a belt or a hairbrush or their hand, on your backside, or make you do a little dance there out in the yard with a little switch.
With a switch, yeah.
The toughest thing was go cut me a switch. You go try and cut a little one, and no, that ain't gonna do it. And I'm gonna do it. And they come back with this big lumberjack, that's a piece of a tree limb. But that has changed now. Those kinds of methods would be looked at as child abuse in today's society, saying, you're using this weapon essentially to beat your kids. Is that a correct assessment? How would you define it, I guess?
I think spanking is going to be, it continues to be and is a big debate. Some parents are like, you can't tell me how to discipline my child. They need to be spanked. Others are that, that stance where it's abuse and it teaches them. I even read some articles where some studies are saying that it teaches them to be aggressive as they get older. But I think it depends on how it's treated with the child and how the parent responds to the child when they're using that particular method. If we have the kind of strength, family strengthening, we have that encouragement, we have that positive relationship between the child and the parent, then they probably could use that method. But all the curriculums that I have personally worked with, their stance is, their official policy is no spanking. And we use the other tactics to avoid abuse.
And a legal situation.
Yes.
The thing that kind of makes me wonder, is there any difference then in the way that, say, an Indian family would deal with this situation versus a non-Indian? Have you ever seen that in your work?
I think no. I think most of our parents kind of handle discipline the same way. We kind of do what our parents did with us, unless we learn other techniques. Maybe we have a family that was severely abused as a child and they don't want to spank. Mm-hmm. So they do seek out other ways to discipline their child. And there are a variety of ways to discipline your child, as long as the structure is there, kids know that mom and dad are in charge, and that positive relationship that nurturing relationship between the parent and the child, or the caregiver and the child, is there. We have room for recovery.
Right. I remember my father, after he had administered such a technique, would always come back later and said, son, I don't want to beat you, I don't want to spank you and make you hurt, but this is why. Mm-hmm. You have to learn not to go across the street and into that field, because whatever reason, snakes, bugs, strange people, but you wouldn't listen, and so this is why you got spanked. So
yes.
Do you understand why now? And I said, yeah, because what are you going to say? No, leave me alone, which would worsen the situation. But is that still in place today, do you think?
I think so. For me in particular, I've spanked my children before, And I have used that tactic as well and let them know this is why this has to happen, or this is why that happened. And for the most part, they understand. But that usually comes later when children can comprehend and can reason. When children are younger, they don't necessarily have that capability.
Yeah, they don't know what's going on, yeah.
Correct.
The Project 123 Magic. Now let's talk about that for a few minutes here. Now this is the series, I guess, of seminars that you're putting on, and each is building on the previous one.
Yes. We are having those on the 22nd and the 29th, which is this coming Monday and the following Monday. Session 1 will cover kind of the bulk of the message, kind of how to count the behaviors and how to encourage the start behaviors. And Session 2 will be, it'll focus more on those start behaviors and how to develop that positive relationship with your child.
The written material here says a humorous look at parenting, a serious look at discipline. Now, at the time I was being disciplined, I didn't particularly find it humorous, but
I don't think any kid does.
Yeah, but how does that work into your goal here? What's the technique? What happens there?
In the training, Dr. Phelan kind of breaks down the 6 basic testing tactics that kiddos use, which is badgering, showing their temper. It could be an aggressive attack or emotional outburst. I think we all know what badgering is, kind of that, mom, please, but why, just this one time? Threatening, kiddo maybe saying, I'm going to run away, I'll never speak to you again. Martyrdom, kind of, nobody loves me, you never let me have my way, you never let me have anything. Buttering you up, telling you, or being nice to you, telling you, oh, your eyes are so pretty, and then asking for what they want. Physical tactics, and that's kind of the last form of testing, and it may be possibly the worst, and that's where you have a frustrated child physically attack the adult or break something or run away. But those are usually found in more smaller kids. So he'll lay out those strategies and kind of show you what those look like. He has video examples of what those look like. And then he'll teach you how to handle them.
The techniques on handling those then obviously are a critical part of these presentations. What might be some of the examples there?
Well, you count the behaviors, and it's similar to, have you ever heard a parent out in public, 1, 2, 3, and then they get a consequence? It's similar to that, except we count these specific behaviors. So say they're whining, that's 1. You pause for a second, give them an opportunity to kind of register, okay, I've been warned. And they can, at that point, walk away from the situation or continue. That's 2. And then the third time, they do receive a consequence. And in this case, it's usually a timeout. I believe it's a minute for every year they're old. So 5 years old, they'll get a 5-minute timeout. And then if they're throwing a fit, you let them throw that fit, let them throw that tantrum, and then their timeout period starts when that tantrum's over. It sounds very difficult, which it is in the beginning. But once the kids kind of catch on and they know that you're going to be consistent, they know that you're not going to give in, they know.
How effective can something like that be? If a kid figures out, okay, well, all I have to do is stand here for 5 minutes and be quiet, and then I can get off and do what I want. Does it really work? How would it sink in, so to speak, I guess?
I see where you're coming with that. And those are a lot of the questions that Dr. Phelan addresses in his videos. And a lot of the people that have come back after implementing this with their children, even though they were skeptical, have come back and said, this actually does work. And that's the whole reason why they call it magic, because a lot of the parents would come back and say, this works like magic.
Ta-da. And sometimes when the child is becoming more progressively loud and abusive, as you mentioned, you're like, you don't love me, I'm going to run away. You know, I had seen an example where some kid tried to pull that on his mother, and she said, go ahead, go on, get out of here. And the kid stopped and looked and said, what?
I wasn't expecting that reaction.
So, you'd throw me out. And I said, well, you're the one that wants to run away. Now, what is it going to be? And all of a sudden, you could see those little wheels turning. I said, well, if I stop doing this, I get to stay inside where it's warm and dry, or something like that.
Some of the tactics that they use in handling the behaviors are natural consequences, and that's kind of what you described to me. You gave them a natural consequence. Okay, that's what you want to do. Go ahead. But that's only going to work when they're old enough and able to reason.
And realize it's cold outside.
Yes.
This kind of thing. Now, and encouraging good behavior, there are, I guess, I probably mentioned one, with my dad coming to talk to me, but there's got to be others out there.
For the younger ones, you can use things like charting. So say there's a specific behavior that you want them to work towards. Maybe that's brushing their teeth every morning. Or so for every morning they get up and they go brush their teeth, they get a sticker. So they get to see their progress and they get an immediate reward. So that's called charting. And other ones, the positive reinforcement. So you praise the behavior that you want to see. But like, I really appreciate that, makes me feel good, that makes me smile when you do such and such. 2 simple requests. So if you are going to give them instructions, keep it plain, simple, short and sweet. Please go take the trash out.
You mentioned the word rewards, which brings up another category, subject there. Is that a good idea, saying, well, if you clean up your room, I'll give you a quarter, or whatever else, I'll give you another cookie, things like that? I mean, is kind of almost bribing the kid.
I was going to say, there's a fine line between bribing and reinforcement. When we bribe, we say, I'll give you this if you do that. When we are offering rewards, we make them work for it. And we let them know that ahead of time. And we use if-then statements. So if you do this, then you receive this.
So, if you work and clean up that dirty room, then you'll get $1 or something like that.
Mm-hmm.
But not until then. I'm going to come back and check and see if you stuffed everything under the bed,
Correct.
And if it's not, then you'll have to do it until it's done. And then you get your $1. Okay. Now, the project launch, your 1, 2, 3 magic doesn't end there. It goes on to strengthening those relationships between parent and child.
Yes, that will be the second part of the training, and that will be on the 29th. And they kind of teach parents to strengthen their child by empowering them to give their kids realistic self-esteem. Teaches them to avoid overparenting, teaches them to avoid the nagging, and engage in active listening versus kind of preaching. So we talk about the affection and the praise, the listening and the counting, and then having one-on-one fun with your child. So, letting them know, I am the disciplinarian, but I'm also here to love you, and I do care about you. And developing, that nurturing relationship.
Right. So if, you're good, we can go get an ice cream cone later on or something like that.
Yeah.
The subject, I'm sure we spend a big chunk of the afternoon talking about it, but now let's discuss the logistical situation, the dates and locations, first of all.
Okay. Dates, again, will be this coming Monday, January 22nd, from 1 to 5, and it'll be at the Housing Authority building here in Okmulgee.
Second floor conference?
Yes. Okay. Second floor conference room. You do have to register. The last I checked, we only had a few spots, so it filled up pretty quickly.
Good.
And the second training date, same location, same time, will be on the 29th, January 29th.
Is there any cost?
No.
Great.
We do, since we had such a great response to the registration, we do plan to do another one in June. So if you find that registration link and it says that we're closed, you can email me. My information is on that pop-up. You can email me and we can put you on the wait list for June.
And to call you?
To call me would be 918-224-9307.
You know, the obvious next step is to see how effective this is. Now, is there some way you're going to be measuring what you've done here or will be doing here? Is there like a feedback form or?
There is a pre and post test. When parents come in, we'll have them take that pre-test. So we'll just kind of see where they're at before we present this information to them. And at the end, we'll measure how they perform.
Okay. And should parents bring those children?
To this training, no. We want your full attention, and we do not have enough staff to be able to offer childcare.
Okay, and so it's a good idea for little kids not to find out what you're up to.
That too.
All right, now, is there anything else you'd kind of like to leave our listeners about what you're trying to do here? It's not to tell them how to raise their kids, but here.
Right. That is something that I tell my parents every time I run a parenting class and I have a new parent come in. I always let them know, these are what's considered evidence-based best practices in rearing children. We're not saying you're an awful parent, you're doing everything wrong. We're not saying that at all. And when they come in and they learn the new skills, I tell them to take what you've learned and make it your own. Use these skills, pair it with what you already know, and make it your own.
Do you ever have any of these participants kind of let's call it take a cheap shot saying, well, that's what you do for white kids, it doesn't work for Indian kids?
Surprisingly, no. I've never had that comment.
Good.
Or anything like that. For the most part, I kind of see my parents as they're in my class kind of have that aha moment. Mm-hmm. They're like, okay, this is why this doesn't work, or this is what my parents did wrong, or okay, I can do that. This makes sense.
All right. Well, is there any final thoughts you might want to leave with our listeners here as we wrap this up?
One of the biggest stigmas I think we've come across in teaching parenting classes is a lot of parents are like, I don't need parenting classes. I know how to be a parent. But again, it's not us trying to preach at you and tell you you're doing it wrong. We are there to offer support, kind of give you new skills, I think every parent has hit that frustration point where like, I don't know what to do. Mm-hmm. And we want to be able to offer that support and a little bit of hope with these workshops.
Okay, well, great. And you won't have to tell them to go out and cut a switch.
Yes, that's what yes.
Well, thank you, Natalie Russell. We appreciate you coming in and talking with us. Keep us posted on how this goes. We want to find out what happens there and any other projects you might have.
Okay, wonderful. Okay, thanks for having me.
Pleasure. All right, well, let me take care of a couple of community notices real fast, and we'll be out of here. Mvskoke Creek Nation's At-Large Citizens Quarterly Outreach, January 19th, the Oklahoma City Mvskoke Creek Association in OKC. Give Jabon Gouge a buzz, 918-732-7752. There's a T-shirt contest for the young people with their upcoming seminar. Let's see here. Let's just read the silly thing. They're accepting artwork entries until the 26th, and kindergarten and young children. The theme is youth violating. God, thinking of the other interview here. Theme is youth celebrating traditions. There's a good one. And they want to see their use of creativity and how well the artwork relates to the theme. So you might want to give them a call. That's at the Mvskoke Nation Youth Services, And let's see, we've got phone number there. Yeah, 732-7600, and ask for youth services. That's it for me. We're done. I thank you for listening. We'll be back next week. You've been listening to Mvskoke Radio. Join us again next week for more local, tribal, and community news and updates. Madam.